imetosha. Full intro. Restart it. Fade it. Thank you. Ladies and gentlemen, it's another wonderful opportunity that I want to speak specifically to the African immigrant community. And it's always a good opportunity for us to basically come forward and give you some information pertaining a very serious pandemic, which many of us think that it's no longer in existence. But I can tell you for sure that the HIV and AIDS is really a big problem in our society. And we are going to at least try to look at some of the statistics we have today pertaining this particular pandemic. Again, I repeat, it's a great opportunity this evening that I really want to pertinently speak to my African immigrant community or the people of color in general. There is a silent pandemic affecting many of our people across the state of Minnesota, and not only in the state of Minnesota, but across the nation, the HIV and AIDS. So, my brothers and sisters, let's be very careful. We thought that this disease has been contained completely, but to our surprise, when we look at the statistic from the Department of Health, Minnesota, to be specific, we've found that overall the number of newly diagnosed HIV infections report increased by 8%, with 298 cases reported in 2021 compared to 275 in 2019. So almost 2/3 of, that is 65% of the new HIV cases are actually among the communities or the people of color. The number of people living with HIV/AIDS in Minnesota is 9,697. What are we supposed to do? What are we supposed to employ, or which methodologies are we supposed to employ to ensure that our people don't get infected with HIV/AIDS? There's so many case scenarios we can actually quote, but there are so many also ways the community at large has tried their level best, especially in our NGOs, in our organizations, which has really tried its level best to ensure that they focus on enlightening our communities on how to prevent this pandemic, which is really very prevalent right now, as per the statistics relay the information we got from them, we are getting from them, is that it's an 8% increase, and the numbers of 2022 have not been released, but I can for sure tell you that if the numbers come out, you'll be surprised that many of our people have actually been infected with this disease. If you really need to get help, the best option is to go to your local provider so that you can get more information on how you can prevent this particular disease. There are very many ways of preventing it, and if in case you got it, it is not a death sentence. The best option for you to do is work with your care provider, healthcare provider, to give you ways and means of taking care of your body so that you can have a longer life. There are very nice medications out there, and your healthcare provider will definitely, or your primary healthcare provider will definitely work with you and ensure that you get this disease contained. And I repeat, it's not a death sentence. The best option for you is just to work with your healthcare providers to ensure that you'll be good and you'll be well taken care of. So, and as we continue this particular conversation, this is September, and we are going to start this conversation honestly in October. And from there, we'll be bringing many experts. Some of them, people have been actually affected by the HIV/AIDS. They'll be telling us what they've actually done in their capacity as people have been infected, or in their capacity as experts, so that they can churn out this good information to the community, so that the community can be protected, and those affected or infected can also get assistance. So I'm appealing to everyone out there to work with the KDR TV News International, so that we can be dealing with this pandemic. We can correlate the information we have out here. We are going to work with the Minnesota Department of Health to bring you more information on how we really need to ensure that this disease is contained. So I'm again pleading with you honestly to come forward so that we get this thing dealt with. I'm again appealing to you by telling you that the experts will be giving us information on how to prevent or treat this pandemic. Thank you very much. Till next time, when we'll be bringing more experts to speak about this particular pandemic, we'll definitely give you an opportunity so that you can also be heard. And again, I say there are many organizations out there who are helping the African immigrants, and we'll also be inviting those organizations to come and speak to us at this particular time, so that they can also help us on how to deal with this particular, we call it a silent pandemic, which is affecting the African immigrant or the people of color. Thank you. And from the African and from the KDR TV show, my name is Omweri. May God bless you. Till next time, when we will be bringing you another discussion, or when we bring you experts who will churn out the information about this pandemic. Till next time, may God bless you. Thank you. Bye.